So one of the problems that we were trying to solve was to move away from 13 or 14 disparate systems, which incorporated cleaning, catering, portering and help desk. Each system had its own login procedure, had its own admin rights. It took an awful lot of training, lots and lots of different access levels. Data was stored and filed in different formats, so it was always very, very difficult to get unified business reports out. We wanted one unified system where actually we could put all of our resource and our focus into ensuring that the system delivered for us exactly what we wanted. The reason that we made the decision to go with this system was it was the only one that was fully unified and actually delivered every single service that we required out of one system and one data set. The system has had a massive impact on processing time. Within the first month, it removed 80,000 pieces of printed paper out of our soft FM processors. What we have managed to do is streamline and increase the speed of our delivery, not only of portering jobs, but also the speed at which jobs are logged with our help desk. Prior to the system going in, 70% of all jobs that were logged for soft FM were done via the telephone. A clinician would have to log a task by phoning a help desk. The help desk would then have to enter the task into the system would then transport that to a dispatcher, and then the dispatcher would allocate the task to an end user. With this new system that we've put in, because it's all digital, the use of apps, the use of desktops, mobiles, the clinician just logs the task and the system will find the nearest available resource to be able to deliver that task, and it's completely seamless. The feedback that we had from our clinical teams actually surprised us. It was such a huge reduction in admin burden because it was so easy and it was so intuitive. And actually we're now trying to catch up with the number of self-service screens that the clinical teams are actually requesting us to do. One of the benefits of a fully integrated system, it helps us to improve patient flow throughout our hospitals. We can understand very, very clearly the peaks and the troughs of when our patients are requiring services, and it helps us to plan and deliver those services more effectively. We have different levels of technical ability through all of our teams, and wholeheartedly the feedback that we've had is that it's such an intuitive system. It was very, very easy to adopt. Patients really enjoyed the fact that they're using digital technology at the bedside. The days are gone where we were asking the day before what a patient would fancy for their lunch or for their dinner. We're actually doing that now in real time. And because of the integration on the system, it's so fast for us to be able to deliver. We're certainly getting very, very positive feedback from that. From the clinical perspective, the system does indicate what the nutritional needs are of the patient, whether they've got any allergens, but also what we've actually delivered to them so they can use that as part of the clinical record. If anybody was considering using the system, what I'd say is that we had an extremely positive experience in using it. The level of support that was offered and the level of rollout and training and the ongoing and continuous support is really exemplar. Moving on to one unified system meant that we had consistent levels of training through all of our sites. We've got one source of the truth, and our ability to export what information we need is very, very fast, and that has helped us significantly in the management of our services.